Hello. Can't see my hand. No.
Hello.
Hello. I'm Eliana,
I'm Candie.
and we're going to talk to you about hydrocephalus. Um, the word hydro comes from the Greek word water, and cephalus comes from the Greek word head. And when you put them together, it means there's too much fluid in the brain. Head, brain, yeah. Um, this occurs when there's some cerebral. I can't talk. Sorry. Spinal fluid, and it's unable to drain from the brain. Then it becomes backup fluid into like pools in the skull. Um, the CSF fluid is actually clear, and it normally surrounds the brain and the spinal. The brain and the spinal cord. There's actually two types of hydrocephalus, and two main types, because there's actually more than two. I think there's about 5, if I remember. There are two main types: congenital, and that occurs before, after, or during birth, or even later on in life if it's triggered by an accident of some sort. And then there's acquired, which is caused by a blockage or like an accident of some sort.
Okay, next. The symptoms that you can see from having hydrocephalus, they are not always as prominent as it is in an older person than it is in a child. The symptoms can depend on the severity of the condition, meaning that more fluid, the more pressure, the worse the symptoms are. Some of the symptoms include headaches, nausea, vomiting, problems with balance and difficulty walking, memory problems, personality changes, and even sometimes comas and deaths, and a lot more than that as well.
And those are some of the signs in adults or older children, but we were going to focus on the birth defect audio. So the signs in babies, infants or babies under the age of 1 year will appear to have significant swelling in the head. The skull bones, they're thin and bony, plates that haven't fused together. So, and they're connected by fibrous tissues. Get that word right? Fibrous tissues called sutures. These sutures, or soft spots, have not yet hardened, so therefore they can stretch and kind of protrude and accommodate to the excessive fluid that's building in the head. And as a result, the baby will appear to have an abnormally shaped head.
Usually much larger.
It's much larger than a normal child's head. Let me see if I can pull up a picture of what I'm talking about. But there are other signs you could look for, like bulging soft spots. Like babies usually have soft spots located around their head, and they seem bigger. Or split sutures, a gap that can be felt between the skull bone, rapid increase of head circumference, swollen veins that are recognizable to the naked eye, or downcast of the eyes called sunsetting. And this is a picture of what a child might look like with esque. And there's more pictures. If I can, there we go. Oh, well, hell, did not mean for that text to come up. There's pictures. Okay. And depending on the severity of the conditions, kids might also experience like sleepiness, irritability, vomiting, seizures. In cases of a child, also might experience like failure to thrive, meaning that they can't, or she might miss like growth developments, like major milestones in a child or toddler's life.
Which is like speech and stuff.
Speech, walking, talking, etc.
Okay. There are a few different types of treatments that doctors try to do to help with the hydrocephalus. These are usually after birth, and so we didn't really study much about the during or before, but after birth, you can use medicines or steroids to help reduce the amount of swelling if it's kind of a minor case. Also, there's the third ventriculostomy.
Ventricular
Ventriculostomy.
Yeah.
Anyway,
Big word.
this is where a hole is drilled in the brain cavity to reroute the fluid straight to be absorbed somewhere else in the body. The major treatment that they try to use is a shunt procedure placement, and that's where they take a shunt, which is a tube that can help drain off fluids, and they put one end of this tube into the fluid buildup in the brain, and they put the other tube, or the other end of the tube, into a major chest cavity, like around the heart or the lungs, where the fluid can be absorbed by the body and into the blood system. The results are usually about 30% usually fail, and they end up having to redo the surgery. And so, also one problem with that is the infections can occur from the surgery itself.
And there you have it. Hydrocephalus in a nutshell.
Thank you.